Hello my dear students, today we are going to see how to do positioning for chest PA view. So when we are taking the PA view, the direction of the beam is posterior to anterior. So here you can see that the anterior aspect of the patient body will touch the cassette and the beam will be directed from posterior side. So as in chest x-ray we are going to cover larger area, so we are going to take two sizes of cassette. For adult we are going to use 14-17 size, and for pediatric we are going to use 10 into 12 inch size cassette. So before we do the positioning, we have to place the cassette in the chest end. So you can see we have placed the cassette in chest end and we will adjust the area. Next, the distance from the tube to the chest stand will be at least 6 feet. Or 180 centimeter. The purpose of this distance is to reduce the cardiac magnification. So while doing chest x-ray, you have to ask the patient to change to hospital gown. If you won't do this thing, you are going to get such kind of artifacts. So confirm that there is no metal objects left within the patient body. Next thing is, see, sometimes what happens is we can see that patient's hair is falling here. So this type of artifact you can get, which is a mimicry of a shadow or cyst. So at least before the procedure, tie the hair like this as I am showing you here. Now we are going to show you how to do the positioning for chest PA view. So we'll ask the patient to stand here like this in PA position. Next we have to confirm that at least the cassette upper limit should be 1 inch above the shoulder level and the lower limit should touch the dome of diaphragm. If the patient is tall, we have to place the cassette transversely, and if the patient is fat, healthy, we can place the cassette longitudinally as the size of the heart will be small for them. Next we will ask the patient to raise his chin and we will ask him to keep both the hands in the wrist area. Next we will ask them to touch the cassette with the shoulder placing forward. Now this position will be done for the patient who are normal. But if the patient is having any kind of surgeries, we can ask them to embrace the cassette as I am showing you here in the film. Confirm the size right or left, as sometimes you may have patients with dextrocardia. Also confirm that both the shoulders are at equidistance. If we won't do this thing, we may have internal rotations. So now our patient is positioned for chest PA view. So now like this you are going to adjust the FOV. See, we have adjusted the lateral margin and the upper area should be at least 5 inch above the shoulder region, so at least this much. So you can see the cervical rib areas also clearly. The centering point at the level of T7, that is the inferior border of scapula. So that was all about the positioning and centering for our chest PA view. So you can see here the anatomical areas. So another most important thing in our chest view we have to keep in mind is the gender. So this image you can see here is the male patient chest x-ray. Next you are going to see the image is of a female patient. So the main difference between male and female patient is the breast shadow. So that was all about the position for adult patient. Now if you are having infant or pediatric patient, you can use this kind of immobilization devices. This is a pigostat to take the chest PA view. So that was all about our chest PA view. Kindly please don't share this video in social media.